people don't get this experience before where they go just dey, you go see their mama or their papa face, their mouth move one side suddenly, or they just dey talk with their customer for market or for church, come see say the person when they talk to him mouth move one side. You come to wonder, na film be this, I been attack. I don't know whether it don't happen to you before. Or person will come to complain of severe headache as if in brain one burst. The person fit no even do anything. The person will come dey restless suddenly. The person dey fine will come to complain of headache, as if na the worst headache for the person life. I don't know whether you don't experience them before, or you don't hear story of people where it happen to. And you can't ask yourself, wetin fit cause all these things? Wetin dey cause all this wahala? Wetin this thing mean? For this video, we will learn the commonest cause of these symptoms will be stroke. Now, welcome to Think Health with Dr. Neche. Listen, I here we will learn different health issues where they affect us. Now, welcome. Wetin come be stroke? I talk and I say stroke. That's what they call partial stroke. Wetin come be am? Wetin it mean? Stroke now when suddenly the blood supply, the blood where they go for brain, come cut, just like that, suddenly. So as it come cut, that part of the brain will come there for wahala. Sometimes they call brain stroke brain attack because they happen sudden, and wetin it come with they bad. About 13 million people worldwide they affected every year, and 5.5 million of these people they die as a result of stroke. Stroke they kill. So how stroke can't take they happen? I'm sure it dey your mind to ask. Stroke get two types. The one where they very common. Now when the blood where they go the brain, as you see for this video now, you can't block whether by fat or blood where congeal. As you can't block, blood no go keep flow. So the normal artery now waiting they carry blood they go for every part of our body, including the brain. You see, I see it they wide, they JJ, the blood just the flow. But in many people, fat go come the full arm. You can't reduce the space where blood supposed pass. As you no fit pass freely again, one day you go come block. The day where you block, either by blood where congeal or fat, they go say the person gets stroke. You see, as the blood, the arrow they show, you don't they return back because you no fit flow. That part of the brain will come there for wahala, no fit function, they come die. Now it be stroke. The second type we know they to come, but they very severe. Now the type where the blood vessel go come weak, come form day like bolombolo. In some people, it go come burst one day. As a burst, blood go come yakata, full the brain, come the paw. That type they call them hemorrhagic stroke because now the blood artery come burst, blood go come the flow, the waste, the person go come they get severe headache and all those problems. This one are the second type of stroke. So as the blood where they reach the blood, no one they reach now. This brain cells where we they watch for these things where they see now brain cells, and so the brain cells they inside our brain. Small. No can get blood. And now that blood they carry oxygen, they carry food, they carry everything they go the brain. What will gonna happen? These blood cells, these brain cells where they there, they die. This one no food, no water, no oxygen. That part where the blood vessel supposed reach will come die. It talks, say I talk say na only part of the brain. And that part of the brain gets waiting they do. This our brain as God can't do. It don't map them, put control. Everything where would they do, they come from brain. Brain they like brain box where they motor, where they computer, where they phone. So any part where they affected, the person no go feel waka, or no fit talk, or no fit swallow, or no fit do things where they do. So the brain they control every single thing. I know so we get left and right. The right they control the left. Now it make when it happen one side, you go say na partial, na stroke. All of them na stroke. If it even affect memory, emotions, language, person no go understand, you go come the day confused. All na stroke. So who fit get stroke? Before una begin shout God forbid, no be my portion. Allah kiyaye, chukwaju. No una wait. Any of us fit get stroke. Me and you when you watch this video, even me, I fit get stroke. But they get certain things where they increase the chances. Say Mr. A get and pass Mr. B. And I think where would they call risk factor. So the best way to protect yourself and your loved ones now to understand your risk factor, know waiting my risks and how to control it. They get the one wey we fit control. So wetin come be the risk factors or the causes of stroke? I go talk am. High blood pressure. Many of times our people they get high blood pressure. I don't talk say I get a video where we talk about high blood pressure. High blood pressure and black people na friends. High blood pressure na number one leading cause. The next one na high cholesterol. Many of us want to check am. And no cost to check am. The next one na heart disease. Yes, when person get heart disease, the heart no go dey pump well, so blood go come dey congeal, come dey block all these vessels. Diabetes. Yes, diabetes. When person get diabetes, the blood dey sluggish. The blood vessels will come change. Now you make if person get diabetes, go dey drink him medicine. They do wetin you supposed to. Obesity. Obesity na the new disease wey dey kill. Obesity don overtake many diseases. Even for children, we feel say to fat na easy. Na lie. Na wahala be that, because you see, as I show you now, the blood vessel block. Sickler, being a sickler is a risk factor. They get certain behaviors too, where they increase our chances to get stroke. Like physical inactivity. When person no dey exercise, they stay one place. Cholesterol will come dey increase. Blood pressure will come dey increase. Obesity will come dey increase. You see, indirectly, too much alcohol they affect the heart. They make our vessels no go strong, so if it burst, if it block, no go come dey flexible as it's supposed to be. Too much alcohol, too much salt and fats. Salt, I don't talk am, na the elder brother or na the brother to high blood pressure. If they chop too much salt, BP go come. The same thing to fat. Tobacco, when you smoke, your blood vessels go come get wound. No go come dey smooth. So blood fit block easily for your own. Cocaine, to spoil the heart and the blood vessels. So when you can't spoil am, wetin go happen? One day go just block. Then they get the one where we no fit change. They call them non-modifiable risk factors. We no fit do anything about them. Like age. As person dey age, stroke, the risks of stroke they dey higher. So especially when you don't reach 40 years and above. Then family history. If person don't get family member where don't get stroke, or we get hypertension or diabetes, you don't get the risk. There's a risk of stroke there. Women they get stroke past men. Now so research show. So don't be say men go relax. No. Black race. As we come the African or African American or Hispanics, we get higher risks of stroke than other people because we also have higher risks of BP. So what come be the symptoms? What you go see, you go say, this thing fit be stroke. If you see the face drop one side, the face no come dey equal. If you talk, your mouth move one side, suddenly you know say na stroke be that too. Or the person no fit carry in hand. Maybe the person dey inside keke, suddenly no fit comot for keke. Or the person dey do right, suddenly no fit right. Or the person wake up in the morning, no fit get up from bed. Or the person dey waka, suddenly fall because you no fit waka. Or the person no fit talk. All these things na symptoms of stroke. Or you talk to am, the person suddenly no fit understand you. Or you want to get blah suddenly no fit talk. Na symptoms of stroke be that. Or suddenly you notice say the person collapse. Or you go for your mama room or papa room or your friend room or your husband or wife. The person no fit wake up again. You lose consciousness. Or the person complain of dizziness as if the whole house they turn around. Come the walk as if he drink alcohol. Suddenly dizziness na symptom. Or the person no fit swallow. You come to say apart from the hand no the waka. If you want swallow, you no fit swallow. Suddenly just like that, it fit be stroke. So what do you can do if you notice all these symptoms why I don't talk about? Or the person wey dey around you get these symptoms. You go remember wetin dey this screen, be fast. Now the way Oyibo people don't bring out this thing, make it dey easy for us to understand and remember. Number 1, be balance. If the person no can get balance, they can't walk as if in drink alcohol suddenly. If it be stroke. Eyes. If the person can suddenly no fit see again, if it be stroke, it's right on one eye or both eyes. Or the face no can dey equal. But instead the person may smile, his face move one side. Or the arm can dey weak or the leg can dey weak. Na A. And S na speech. The last one na time. You go come check the time this thing happen when you notice am. Even you, if na you dey happen to, go check the time because the time dey important, very important. So be fast. Another way we fit remember am. You know all this one where they sing lo 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 lo. You go come say be fast o, something like that. You go take remember. So if you see anybody, so now I dey teach una how to become small doctor for una side. If you see say the person no fit smile, you ask am to find the face no come dey equal, the person get stroke. Or the arm no fit waka, you no fit use the hand or the leg. The hand dey come down, you no fit raise am, e fit be stroke. Or the person no fit talk. You ask person to say something, you no fit talk am, or you dey talk to the person no suddenly no fit understand you. Speech don dey affected. So you go come check the time. You know, so they go say call 911, but you know, so for our area we no get 911. So you go find motor, you go find your neighbor, call them, make they carry the person or carry you go. Even if you get motor, you no go drive am because that time brain attack don happen, stroke don happen. So you go rush the person go hospital. So remember, be fast or fast. So you go find ambulance or motor. You know, say ambulance now. So when we hear ambulance, we think say only dead people they carry. No, you fit even find any motor, keke, anything. Carry the person, rush am straight to hospital. Even if you dey village, the nearest hospital where they there, you go rush the person go there because the person go need attention. So number one thing what we go do now to rush to the hospital. So when we come rush to the hospital, we fit dey there. From there, they go refer you to go see neurologist, any big center like FMC or teaching hospitals or any stroke center where they for that area. You can't they avoid reoccurrence. Stroke, say a stroke happen, if it happen again, no. If all these things what I mentioned, you know, they can't put eye, chook eye, they prevent them, or they take your medicine, stroke fit happen again. So you can't they avoid them. So when you come manage you finish for hospital, you can't go physiotherapy. I dey talk some because they important. I don't see plenty people who get stroke. They don't go physiotherapy. They say, may I go herbal, may I go massaging. It dey beyond massaging. Physiotherapists are people where they don't train to help you make that hand, make that leg, make that mouth come the walker. You see as they show for this end. Now so if you go hospital, they get physiotherapy department. They go teach you how you go take walker, how you go take do everything. May you return back to your daily life. May you return back. And if you get more questions or tips, you go fit ask them for your comment section. I will answer you. Or if you ask for a neurologist, maybe you want to see a neurologist, ask. I will show you how to see a neurologist. You can't ask them the question. Oh, and don't forget to like, share, oh, subscribe. Now for free. Stroke the kill, and more act fast. Thank you. Bye bye.